Measuring NHS productivity is a really difficult challenge. Hospitals and GP practices and the whole NHS produce a huge range of outputs, ultimately trying to improve people's health. So if we want to measure productivity, we need to have good measures of those outputs and outcomes. We're still very focused on how many patients are being treated, how many operations are being delivered. That's good, but ideally we'd go one step further and think about the outcomes.
We're measuring productivity for healthcare and the NHS better than we ever have. We've got really comprehensive measures for what we're putting in and what we're getting out in terms of the activity. And at ONS, what we do as well is we make an adjustment for quality. So we're trying to move towards an outcomes-based approach. So it's very much improving, but there's definitely more that we can do. We need to think more about activities such as preventative care and early interventions.
So I think what's important is that we are measuring NHS productivity and that we're measuring it at the level of each individual trust in the NHS. So we take the ONS national aggregate measure and we use a very similar methodology for each NHS trust, and that means that we have a measure of productivity at each trust level, and we can use that to not only monitor performance but to use as a tool for improvement.
I think one untapped opportunity in this digital age is more frequent, more persistent, more comprehensive patient experience and patient outcome information. We have hundreds of millions of appointments in the NHS each year, and it serves a massive population of people. And if we were able to capture some of that data in a systematic way, we would learn a lot about the performance of the NHS at a very local level. And I think some of those insights would allow organisations then to improve both productivity and broader metrics of performance.